Hello everyone, welcome to sqadia.com, and in our final section of the lecture topic menopause and post-reproductive health, we will continue to talk about some post-menopausal reproductive health problems. And in this section, we will mainly talk about the effect of the menopause on the cardiovascular system, on the cognitive function, and on the urogenital tract and vulvovaginal atrophy. Cognitive functions usually which are affected, there is dementia, which is loss of memory, and there is change in the memory and global cognitive function. Cognitive functions are the functions related to acquiring knowledge and learning, and those processes are affected in the menopause. So there is slow process of learning and acquiring knowledge. Some endometrial effects of the menopause, usually there is a post-menopausal bleeding. When there is post-menopausal bleeding, endometrium usually after cessation of menstruation for 12 months, and once the label of menopause is given, then after 1 or 2 years there is uterine bleeding, and this is post-menopausal bleeding. And the cause of this post-menopausal bleeding is usually endometrial. So first, clinical assessment is done, and in the clinical assessment, two groups are identified, whether they are on tamoxifen or not on tamoxifen. Tamoxifen, if they are not on tamoxifen, then transvaginal ultrasound is done, and then endometrial thickness is noted. If the endometrial thickness is less than 4 millimeter, usually there is follow-up done. But if the endometrial thickness is more than 5 millimeter, then usually the saline sonography is done, and then there is a finding of lesion, and biopsy is done. And the tissue is removed for biopsy, and then if the biopsy tells if there is a malignancy or if just the normal endometrial hyperplasia, or there is hyperproliferation of the endometrium due to lack of estrogen. So this is the in the not on tamoxifen patients. So the transvaginal ultrasound is done. If thickness is more than 5 millimeter, then biopsy of the tissue is done. Biopsy tells us if it is malignancy or if it is just the endometrial hyperplasia. If it's on tamoxifen, then here the next step is referral to gynecologist for endometrial sampling is done. So these are the endometrial effects of the postmenopausal bleeding. The urogenital tract and vulvovaginal atrophy. Here in this diagram, if you see, this is the healthy vagina, but patients with vaginal atrophy, this is the thick and moist vaginal lining. In this, the lining becomes thin and dry. So very thin and dry vagina due to lack of estrogen, and this thin vagina leads to vaginal dryness and itching and dyspareunia. All these are complications due to vaginal thinning or vaginal lining thinning, and there is vaginal atrophy also, ovarian and uterine atrophy and vaginal atrophy. Some cardiovascular effects of the menopause is 30% of deaths are due to ischemic heart disease and stroke. Should be managed accordingly depending on what's the cause. If there is high blood pressure, hypertension should be treated, and with the controlled hypertension, usually we can prevent the stroke and ischemic. If there is ischemic heart disease or angina, that should be managed accordingly with the nitroglycerin tablets. And then there is should be identification of the risk factor is important. If there are risk factors like high blood pressure, high cholesterol levels, those should be managed. Or if there is diabetes, that can be managed. And once the risk factors are managed, usually the chances of stroke and complications of the heart problems are decreased. Improvement if lifestyle is important, healthy diet is very important, and then exercise, regular exercise, at least 40 to 45 minutes every day is very important. And then again, with the lifestyle, improvement in the lifestyle, dietary treatment for the hypertension and hypercholesteremia and hyperlipidemia should not be given to the side. So it's all together, these factors can improve the complications or health effects leading to cardiovascular problems. So this was the cardiovascular effect, urogenital tract, and then vulvovaginal atrophy, and effects of the endometrial bleeding due to the menopause. Thank you for watching sqadia.com.